sai ka ga sarki yana sarauta sai ka tarar gobe ba sarauta ka ci Najeriya an yi canji duka Allah idana wannan.
This is an image depicting the uterine artery using trans-abdominal scan in the first trimester of pregnancy. The indications for uterine artery Doppler are as part of screening for preeclampsia in the first trimester. In the second trimester, as part of anomaly scan, where that is done routinely. In women with chronic hypertension and those with previous preeclampsia. In fetal growth restriction, where donor embryo or egg is used. In autoimmune disease, acquired or hereditary thrombophilia. The uterine artery is a good screening tool, and it is a diagnostic tool in late onset IUGR. In the first trimester, using trans-abdominal image, the mid-sagittal section of the uterus is obtained as seen here, and the cervical canal identified. The prop is angled to either side, as you can see. This demonstrates beautifully the uterine artery. Measurements are taken at the points before the uterine artery branches into the arcuate artery, or at the point of the internal os. The gauge size should be 2 millimeters. In the second trimester of pregnancy and the third trimester, as shown in this image, the prop is placed longitudinally in the lower lateral quadrant of the abdomen and angled medially in the parasagittal plane. When the collar is applied, it displays the uterine artery as it crosses the external iliac artery. The sample volume is placed 1 centimeter downstream from the crossover point. This is a transvaginal image in the second trimester of pregnancy, demonstrating the spectral Doppler of the uterine artery. Here you can see subtle diastolic notches. If notch is unilateral, it is usually on the side where placenta is not dominant. Presence of uterine artery notches is associated with increased risk of preeclampsia and fetal growth restriction. The risk is higher when notches are bilateral. Generally, bilateral notches are seen in 50% of normal pregnancies in the first trimester. When notches are deep, they are more significant. Persistent notches are more significant than intermittent notches. But transient and shallow notches may actually be due to uterine contractions. Uterine artery Doppler for second trimester is best performed towards the 24th week of gestation. When uterine artery PI is calculated, it should be borne in mind that the PI on transvaginal scan is higher than the PI on transabdominal scan. Therefore, appropriate reference ranges should be used. The normal waveform has a high systolic and a high end diastolic velocity, which is typical of low resistance flow. High resistance flow may be seen up to 12 weeks, but should not be seen by the 18th week of gestation. Generally, the peak systolic velocity here should be more than 60 centimeters per second. If it is less than that, the possibility is that it is the branch of the uterine artery that is sampled and not the uterine artery. This is also a transvaginal image depicting spectral aliasing. On spectral Doppler, aliasing is represented by cutting off of the peaks of systolic flow, with the peaks coming on the other side of the baseline, as can be seen here. So with spectral aliasing, it is difficult to get the correct measurement of Doppler indices. Spectral aliasing can be corrected by adjusting the baseline or increasing the PRF or velocity scale, as others call it, decreasing the frequency, or increasing the Doppler angle. Note the characteristic sound of the uterine.
Sai ka taran yau ko babu ahu, sai ka taran gobe kai mota, ka taran gobe kai gidaje, to duka Allah ya gane sirrin, duka Allah ya gane wannan, ai san go Allah.